Hi, I'm Dr. Prashantha, Senior Aesthetic Plastic Surgeon operating out of Naipunya Aesthetic Clinic, Bangalore, India. Ultimate guide to your facelift. So let's go stepwise in understanding this fantastic and powerful procedure. Who are candidates for deep plane facelift? If you look at the mirror and feel that doing this, lifting your face up, lifting your neck up, you feel more confident, you feel that you look younger, and this is how it was before, then you are a candidate for facelift. And if you pull your eyebrow also, if the skin gathers around your eyes and it needs to be pulled here also to make it look younger, then we need to add an eyebrow lift. It is as simple as it is. Other way to know whether you are a candidate for facelift or something else is to compare your old photographs to the present photographs. If you feel that your face has become longer and there are jowls and the face has lost volume, then again you are a candidate for facelift. So please do not go by the trend. Do the procedure that suits you. If you feel better by lifting the face, facelift is for you. If you feel that volume loss only is there, then fillers or fat grafting is a solution for you. We should match the procedure to your face. You should not undergo a procedure that is already there, and your face, whether it suits your face or not, you should not undergo because it is trending. Understand? So it's very important for you to consult an aesthetic plastic surgeon with very good experience and all these skill set. See, if you have only a hammer, everything looks like a nail. It's important to have a screwdriver and put a screw when it is necessary, hammer and put a nail when it is necessary. So same way, you should go to a doctor, aesthetic plastic surgeon, who has in his repertoire fillers, botox, fat grafting, minimal invasive Scarless facelift, deep plane facelift, and non-invasive methods like HIFU. You can choose, discuss and decide what suits you and what you would want, and then arrive at a solution which will be definitely beneficial to you. What is the difference between deep plane facelift and other facelifts? This is a very important question because there are hundreds of variations of facelift and each one becomes popular in certain period of time and then it fades away. But what you need to understand is a concept called smash layer. That's a layer which is deep to the skin. Deep plane facelift goes under the smash layer. Other facelifts are going on the smash layer and are tightening the smash layer. So deep plane facelift actually moves the smash layer after releasing the ligaments which are holding it like pegs down. It is very important for your surgeon to examine you and see what suits you the best. If you consider all the facelift procedures that are available, least invasive and the most effective type of facelift is called deep plane facelift, because in this we don't separate components of face like skin, smash and other things. So we only undermine the skin in a limited area and then go deep into the deep plane and release all the ligaments and move it up. It is as simple as it. It needs a lot of technical capabilities and experience, but when done, when planned, executed properly, this is the most powerful way of anti-aging. It puts your face back by a decade, sometimes by 2 decades, and the results last really long, and downtime is the least for this. So this is a revolutionary new technique which has taken over all over the world, and we have been practicing this, and you can understand and then decide if it suits you. How do you decide whether Scarless facelift is for you or a conventional deep plane facelift is for you? See, both Scarless facelift and conventional deep plane facelift, both of which we do, are deep plane facelifts. So let's focus on these two. So if we examine and find that your sagging is mainly in the smash layer and the skin quality is good, then Scarless facelift is for you. If your age group is between 35 to 50, then Scarless deep plane facelift is for you. If your age is more than 55 or the skin has aged much faster than your chronological age, then if you have to remove a bit of your skin to tighten it, then we have to do a conventional deep plane facelift. In this, in addition to moving the smash layer up and rewinding the sag, we also trim off excess skin. We also treat the damaged skin with the help of surgical lasers. So the difference is mainly if the skin also has aged significantly compared to the smash layer. What all preparation you need to do before deep plane facelift? Most important preparation you have to do is to understand the procedure. Like, you need to understand what are all the requirements you have in your mind and what all can be practically achieved. So we sit in for a discussion and analyze like where there is volume loss, how much tissue has migrated, and simple tests like pulling the tissues up and showing you. These we need to spend time together to understand like what changes have happened and what changes you want to address. Then we need to look at your previous photographs to see how changes have happened and in which chronology you want to age back, or you want a very drastic transformation, or you want it very natural. So it all depends, and these are very precise procedures which we can plan. We sometimes do ultrasound and dissolve if you have any fillers, and if you have done threads before, we need the details so that we can actually plan and map. Then we do pre-operative investigations and anesthetic checkup, and then we schedule the surgery. How will be the day of surgery of a deep plane facelift? Typically, we do the markings discussion again, what we have done in the previous consultations, and once we are through, like we do this under conscious sedation or general anesthesia, depending on preference of you and the anesthesiologist, and then we go ahead with tumescence of undermining skin, that is we put in a fluid where it shrinks the blood vessels and reduces the blood loss to a few milliliters, and then the surgery is begun, and we enter the deep plane at the decided place, and then we decide the deep plane and preserve the nerves and fix the smash in the more youthful position. And typically when we are given the tumescence, we harvest the fat for fat grafting, and we use that fat to fill areas like where there is volume loss. We also do nano fat and inject the nano fat to rejuvenate the skin and to repair the skin where it is damaged because of aging and sunlight. So the procedure typically takes roughly about 4 hours, and you wake up from the procedure with slight tightness and little haziness in the eyes and little irritation in the throat. But it's a very smooth, comfortable journey always, and evening you are allowed to take fluids orally, and you are given your first meal, and then you are made to walk around a few steps in the hospital premises only. And if you are from outstation or from outside the country, we suggest that you stay with us overnight, and then next day morning we give icing of the face and then check on the dressings, and then you are good to go home. This is the typical surgery day for deep plane facelift. How will be the immediate post-operative period for facelift? Day 1 to 3 of a deep plane facelift, the swelling will increase, and you may notice that there are bruises under, especially if we have done nano fat grafting. There can be some amount of bruising in the areas, and there can be little soreness from where we have taken the fat. Apart from that, face feels tight, swollen, and you will be groggy or little tired. Apart from that, there is nothing in 1 to 3 days. And in this period, we check for whether there is any hematomas. If you have put a net, we remove it, or if you have put a drain, we remove that also. With a slight compression dressing, you are good to start off all activities which you can do, and we encourage you to take short walks, and we don't want you to do any exercises where you have to put your head down and lift weights. We remove the sutures of the deep plane facelift, which is behind the ear and around the ear and in front of the ear, and which goes into the hairline on 7th to 9th day, depending on how it heals. And it heals very beautifully. The line may look little red to begin with, but gradually settles down, and scar is almost invisible once it heals. So from 3rd day to 10th day, the swelling starts decreasing, and bruises steadily reduce, and by 10th day most of the bruises are gone. And this is the time when some skin around the ear becomes little hard because of the swelling, and rest of the things look absolutely fine, and things gradually improve from 10th day to about 6 weeks. Yeah, time of total recovery is usually anywhere between 4 to 8 weeks depending on your body type. And if there are we suggest lymphatic massages and so many other adjunct therapies which help in making you feel better and heal faster. So this is the typical journey of deep plane facelift.